And I imagine, and I'm sure these last 2 years haven't helped. I mean, you're talking, your background is medicine, healthcare. They have really been at the coalface, haven't they, in these last few years? And I imagine that's not an uncommon thought going through many health practitioners' minds, particularly doctors.
Right, you are. The burnout rates in medicine were very high and climbing prior to the pandemic. The pandemic really served to amplify the hallmarks of burnout and intensify the underlying drivers. And so we've seen. I work for now. I work for a state professional health program, and so we saw a wave of practitioners after things began to loosen up and after the pandemic began to die down. We saw a wave of practitioners that were in trouble or troubled by drugs, alcohol, depression, suicide thoughts and ideations, acting out in various ways. And it was all a result of the stress that they were under during the pandemic.
I think another group that's takes a big hit too are teachers and nurses who were really, again, at the coalface, being asked to do things above and beyond.
The caring professions in general usually carry higher rates of burnout because of the emotional impact of the work, of the type of work. So, yeah, medical healthcare personnel, teachers, firefighters, police officers, social workers, all of those professions got hit pretty hard by the pandemic. But again, even before the pandemic, burnout rates were high and climbing.
Yeah. So let's talk about burnout, and how do we define it?
Well, this was figured out in the 1980s by a very smart doctor by the name of Christina Maslach. And she developed actually the Maslach Burnout Inventory, which is a screening tool for professional job-related burnout or job-related burnout in general. And that tool has held up since the 80s. For the last 40 years, it still has scientific validity and is very accurate at measuring burnout in a particular individual. And it measures three things. There are three principal hallmarks to burnout. The first is emotional exhaustion. And that's when the person becomes, they feel like they've left it all out there, that they've given all that they have to give, or that they have nothing left to give. They can no longer connect on an emotional or psychological level to the client, the customer, or the patient, or their staff or colleagues. The second hallmark is depersonalization. That's a fancy term for the individual becomes cynical. They develop negative feelings toward those they serve, and they develop negative feelings toward what they do. And they also disconnect from what they do and who they serve. So they no longer feel that sense of connection that they once did for their chosen job or profession. And the last hallmark is a lack of a sense of personal accomplishment. And that's when the individual feels like no matter what they do, it's not making a difference. They feel like it's not making a difference in the lives of those they serve. And it's also not making a difference in their life anymore. They no longer feel that intrinsic reward from the job that they've chosen to do. So those are the three hallmarks or symptoms of burnout: emotional exhaustion, depersonalization, and a lack of a sense of personal accomplishment.
I mean, this casts my mind to a study that was done by the Gallup organization looking at engagement. And I know engagement in the workplace is a huge issue.
Right. And it's the exact opposite of burnout. The three hallmarks of engagement are vigor, dedication, and absorption. Vigor is energy, which is the exact opposite of emotional exhaustion. Absorption is involvement. And so rather than detaching, you get involved. And absorption is when you are so into your work that all else seems to melt away. And so the key word for that is efficacy. People feel like they're efficacious in what they do. So it's the exact opposite of a lack of a sense of personal accomplishment. So the engagement then is the exact opposite of burnout. And everybody wants to be engaged, and every business owner wants engaged employees that demonstrate the vigor, the dedication, and the absorption.